So a boy of 5 is brought to his mother with complaints that over the past year, he had developed a painless 1.5 centimeter swelling on the left side of the neck. So it is painless, but it's a swelling. There's no systemic symptoms. On examination, the swelling is irregular. And I believe I spoke something about irregularity of a mass, isn't it? So mostly if something is irregular, one of the things that you think about could be a cancer. It could be, but not all irregularities are all cancers anyways, but it could be a cancer. All right. It is firm, mildly tender, and moves with deglutition. Even though they say it is painless, but they say it is what? It is mildly tender. That means that when you touch it, there is pain. When you touch it, there is pain. All right. There are no other cervical swellings. No other swellings. So just this mass that moves with swallowing or deglutition. That is what is there. So again, start thinking your neck. What structures can be found at your neck area? And which one of them is very, 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 very common? I believe if I ask you guys if you have seen goiter before, I believe many of you say you have seen goiter before. And yes, you are not far from the correct answer. So anything there, you can think about it. Anything there, you can think about it. So it could be what? A goiter. It could be a goiter, right? Swelling is there, it could be a goiter. Okay. But don't forget, goiter simply means that there's swelling. No? But there are different types. Different types. Good. All right. That's just to help you think, anyways. But what is the most likely working diagnosis? Here. The most working diagnosis here will be what? Of course, the thyroid gland. The thyroid gland. Like I said, you are thinking more of what? Something cancerous. So you can say carcinoma of the thyroid gland. Carcinoma of the thyroid gland. All right. Then provide 4 relevant differential diagnosis. Very good. So over here, like I said, anything around the neck area, just mention them, and keep going. So of course, we can talk about what? A multinodular goiter. Multinodular goiter. You can talk about a simple cyst. Simple cyst. You can talk about adenoma. This is a benign tumor. It's a benign tumor of the gland. So you can talk about adenoma. You can also talk about what? An abscess of the thyroid or a chronic abscess of the thyroid gland. Chronic abscess. So again, you can talk about a multinodular goiter. You can think of a simple cyst. You can think of adenoma. You can think of what? A chronic abscess of the thyroid. Chronic abscess of the thyroid. So these things, mention them. But again, start thinking about anything. You can mention a lot of them. There are a lot of things you can look at for. Again, for diagnostic investigations, helpful diagnostic investigations. Again, thyroid is an internal organ, isn't it? So again, you might want to do what? Your ultrasound. Ultrasound. So again, ultrasound of the neck for a thyroid lesion. So ultrasound of the neck. You can also do a thyroid antibodies. Thyroid antibodies. Because it's inflamed, right? So you want to know. Of course, if you're thinking of a cancer too, you might want to do what you call a fine needle aspiration, right? For cytology or for biopsy, and put it that way. So you can do what? A fine needle aspiration cytology. Fine needle aspiration cytology. Then you can do a radionuclear scanning. Radionuclear scanning. So again, ultrasound of the neck, fine needle aspiration cytology, thyroid antibodies, radionuclear scanning. There are a lot of things you can always mention. A lot of things you can mention. But these things, don't forget about them. For therapeutic measures, in other words, what are your treatment modalities? Treatment modalities or therapeutic measures. So again, you might want to do what to call exploration for solid swellings. So you want to what? Explore for the solid swellings. You do what? Aspiration, like I was saying. So aspiration for cystic lesions. Then observations while on a thyroxine therapy. Observation whilst on thyroxine therapy. So L-thyroxine, right? Therapy. Then you do what to call it a lobectomy for a neoplastic swelling. Okay, for a neoplastic swelling. So if you're talking of a tumor, then you do what? A lobectomy. So remove the lobe. That's what it means. Lobectomy. Lobectomy for neoplastic swellings. You can also do what? Watching or observation whilst on medication, right? Then you can also do what to call it the aspirations for cystic lesions. Then explorations for solid swellings. Exploration for solid swellings. So these are our therapeutic what measures that we're going to what adapt. All right. So again, this is a diagram. Yes, come in.
Yeah, I didn't get the therapeutic measures. Can you please?
The what? The measures.
Go by the therapeutic, yes.
The what? Therapeutic measures. Okay.
Yes.
All right. Yeah. So again, I think I'm talking about lobectomy. Lobectomy. If you are thinking of a neoplastic swelling, so remove the lobe. That's lobectomy. They can do observation while on thyroxine therapy. Observation. So, and again, you can do what to call it aspirations for a cystic lesion. So if it's a cyst, you can aspirate. That's what I mean. So aspiration for cystic lesion. So just aspirate. So just put it there and draw the content from that cyst. That's all. And you're going to do what to call it exploration for solid swellings. Exploration for solid. So then you have to actually open up and then remove the swelling, isn't it? Or lobectomy. Please, is it clear now?
Yes.
Wonderful, wonderful, wonderful. All right. So that's what I'm saying. You can mention a lot of differentials, okay? So on the differentials, you can mention all of these that you are seeing. Submandibular, dermoid cyst, thyroglosal cyst, the thyroid gland, which I just mentioned. You can talk about the lymph nodes, the brachial cyst, parotid. All of these things are all differentials that you can think about. All of these are all. So don't be limited to what I just mentioned. All of these are all what? Differentials. They are all differentials. All right. All right. So basically, this brings us to the end of our presentation for the first session.